Dr. Henderson talking about this time a circumcision, every guy's favorite surgery to hear. There's a lot of different myths and things that people say about uncircumcised versus circumcised, that sex is better or worse. And I'll tell you, I have no idea because every patient's different. So I've had patients tell me that intercourse was better after the circumcision. I've had other patients tell me that they kept their foreskin because they thought that being circumcised would ruin it. I don't think there's any way to prove that. It's all patient preference or personal preference. But as far as the circumcision goes, reasons for doing it is, one, you can do it elective, but your insurance usually won't pay for that. But I do have guys who say, I just want to get it done. Two, most of the time when we're performing circumcisions now, it's because of what's called a phimosis, or you get scar tissue on the tip of the foreskin and it closes off, so it makes it hard to go to the bathroom, and you start having a lot of issues with this, starts causing infections, and balanitis or other things can cause an infection of kind of the head of the penis. Those are different reasons for getting it done. There's pain, discomfort, you keep having tearing during intercourse or something. It's a very easy procedure. We've been doing this for a very long time. I feel like all urologists, this is kind of bread and butter, and we're very good at it. We take you to the operating room at the same day procedure. All we do is just take off that extra skin, and then we suture the skin back together. One of the things I'll have guys question me about after the procedure is they say, where's that little ring of kind of red tissue that I'll see on my boy who got circumcised as a baby? And I tell them, we do a better job than that. They just cut the skin off and they let it granulate or scar in, so that's actually scar tissue. When we do circumcisions on adult men or grown-up boys, we actually bring the skin back together and suture it together so that it's full normal skin all the way to the tip or the head of the penis. And that's how it's meant to be, not this granulated tissue that everybody's so used to. It's a very quick procedure, just about 30 minutes in the operating room. You get that extra foreskin and you have this dissolvable suture that will just fall out in about 2 weeks. We do put a little wrap after the initial operation. Most of my patients take that off in 24 hours. And then from there, all my guys say the same thing. The head is now just exposed to all the elements, your underwear, air, different things that it was protected from before with the extra skin. And so it almost gets like a diaper rash is how a lot of my guys explain it. We used to tell guys use Vaseline or different coverings to protect that area of that skin. Otherwise it kind of peels off like a sunburn and then heals back. What all my guys swear by now is Aquaphor, which is just a baby diaper rash cream that has some Vaseline mixed in it there. And that works the best. So you put that on for usually about 2 weeks, and about 2 weeks out when you come back and see us in the office, most of my guys are doing fantastic. It's a very well vascular organ, lots of blood going down there, and so it heals very well because it can get all those nutrients and healing properties to it. As far as work and things like that go, it's different with every patient. I've had some guys go back in 3 days and just not have a lot of pain or discomfort from it. I've had other guys that can't go back to work for the full 2 weeks. So we can do a doctor's note or whatever for that, but it's a great procedure. You heal up really nicely. We even do them in the office for those patients who don't have insurance, and I can do a block of the main nerve there and make everything completely numb, which is pretty incredible. But we prefer it in the operating room and you be asleep instead of watching us do something like that. It's a great procedure. Patients do great. I wouldn't worry too much about it, and it's a pretty easy recovery.